Okay, good morning, afternoon. Hello, everyone. Thank you for being here. And today we have Dr. John Rothwell joining us, and he is going to answer some questions and talk a little bit more with us about this coronavirus pandemic. And there are a lot of questions. There's, excuse me, a lot of information that's floating around, and it's really hard to tell what's accurate and what is not accurate. So hopefully Dr. John will be able to answer some of those questions. I sent you an outline via email of something that's floating around, just one of the many pieces, and we thought we would kind of get started there. One of the things that it said that I thought was interesting was heat melts fat, because it said that this virus is protected by a thin layer of fat. Me too. I'm protected by that as well. So it says heat melts fat, and this is why it's so good to use water above 25 degrees Celsius for washing hands, clothes, and everything. In addition, hot water makes more foam, and that makes it even more useful. So weigh in on that. Is that accurate? Is that fluff?
Well, before I weigh in on that, let me introduce myself. I'm John Rothwell, Doctor of Nursing Practice. So I'm actually an advanced practice registered nurse, not to be confused with a medical doctor or a doctor of osteopathic medicine. And I think that's important for our profession to clarify that. And it's also important to the physicians out there in the world to understand that, you know, nurse practitioners know their role, they know their scope of practice. And while we take a very holistic approach in our approach to care, we really look to do everything that's evidence-based to ensure that we're offering the highest quality of care for our patients. Now, to address the questions, interesting, out of all the questions that you provided me, the one that I had the hardest time with was the one that you just mentioned. And it was really the 25 degrees Celsius. And if you guys don't know, 25 degrees Celsius is 77 degrees Fahrenheit. So that's, you know, kind of more than warm water. But that being said, it's warm enough. Now, I didn't find any real literature that supports 77 degrees or 25 degrees Celsius actually kills the virus. But what's interesting is the writer, and the writer for this was an infectious disease physician at Johns Hopkins, whose mother was a physician, and I think she posted this kind of question on Facebook. And what we didn't see was literature or evidence to support what was being said there. In other words, we're automatically supposed to believe what was written because it's written by a medical professional. And sometimes we have to be very conscientious of that, because what you see in the field, in other words, what you see in the hospital, what you see in urgent care, what you see in primary care, isn't always what you see in the research lab. Now, when it comes to addressing, you know, soap pulling that layer of fat off the virus. So a virus is a non-living organism, and it's a protein that's usually consistent of RNA or DNA, and it has a protective covering, right? So a shield of fat, because water can't get inside. So it's not semi-permeable. In other words, things can't get inside of it. And that's why a lot of medications don't work. It doesn't get inside that virus. So what we do is we say, well, good hand washing, good hand hygiene, use soap and water, use alcohol-based products like 60% alcohol-based hand sanitizer. What the soap does is it binds to this fatty layer. Fatty layer is actually carbohydrates. So if you think about your dishes, when you wash the dishes, you use soap and water, or I hope you do, and you scrub and you turn on warm water or hot water, and it builds up the suds, right? And that binds to the carbohydrates, which is the foods, right? And it washes it down into the sink. The same thing happens to your skin. Have you ever been gardening before?
Yes.
Okay, so when you're out gardening and you get on your knees and hands and they get dirty, the dirt is carbon, right? And so when you wash your hands with soap, the chemicals in the soap actually bind on to that dirt and pull it away from the skin and flush it down the drain. If you don't use soap and water, sure, you'll get some clean, but you'll have some residual there and it won't get it all. And it's that don't get it all aspect when it comes to viruses that really can cause harm to yourself or to those around you.
Well, let me ask you this. That makes me think of a question that I saw posed. Do you have to use an antibacterial soap, or is just a plain old soap okay?
So I love that approach. One of the things I love about being in private practice is I spend a lot of time with my patients in talking about education. Nurses tend to be educators. We love to teach about diabetes and heart disease and these kind of things. When it comes to infectious disease, we also like to educate, whether it's viral or bacterial or fungal. We spend time really focusing on how the overutilization of antibiotics is actually affecting our community. And it's interesting because how it affects the Brevard County community may affect another community in a different place in the country differently. For example, urinary tract infections, there's a 33% resistance rate to ciprofloxacin in Brevard County. And a lot of people don't know that. So if you're unaware of how antibiotics kind of work, then you may actually inadvertently be causing more harm to your patients than actually causing good. Now, we already said that a virus is non-living organism. Well, a bacteria is a living organism, right? So it's an animal, has a nucleus, and it can reproduce, and it lives, and it needs, in order to kill it, antibiotics are often used to kill that, but antibiotics don't work with viruses. And I think it's interesting that if you look at the Center for Disease Control and Prevention, if you look at the World Health Organization, and even some of the literature that's coming out of Italy and out of China, they're actually prescribing azithromycin, which is an antibiotic, for patients who test positive for COVID-19 and for patients who are persons of interest for COVID-19. And one may ask, well, why are they doing that? Well, COVID-19 as a virus actually can cause a viral pneumonia. And that's one of the reasons why it's really has this mortality that we're seeing is they get viral pneumonia and patients have difficulty breathing and then their body starts to shut down. Well, what also happens with viral pneumonia, sometimes you have a co-midden form of a bacterial pneumonia. So what starts off viral then becomes bacterial. I like to talk to my patient about what grows in a warm, moist, dark place. So a lot of people come to me, or we might do a telemedicine visit for a sinus type infection. In your sinus cavities, you have multiple ones underneath your eyes, inside the top of your nose here, top of your heads. And then your eustachian tubes, those tubes that drain your ears, all of those drain down into your face. Well, if you don't dry those sinuses up, then you have fluid there. And that's when you feel congested and that pressure in your head. Well, in 2 to 3 days, that's viral. Don't need antibiotics. Bacteria takes longer time to grow. But the evidence shows that between 10 and 14 days, what was viral, that moisture actually starts to harbor bacteria and it starts to grow. And now you need an antibiotic. So for people going to a clinic or the primary care provider in 2 to 3 days, it's very difficult to say, oh, you know what? You have a bacterial infection. And a ZPak's a perfect way to look at it. Someone comes in, the ZPak's 5 days. The flu lasts for 5 to 7 days. So if I give you a ZPak and you have the flu, is it the ZPak that helped, or is the fact that the virus just ran its course and finally died?
You know, it's interesting that you say that because, you know, when I first started seeing you in December, the end of December is when I found you. I'm very thankful that I did. And I was really, really sick. Wasn't under great circumstances. I was really, really sick, which we've made some, we've got some theories about that now. In hindsight, it's 2020. But it's interesting you say that, because that is exactly what happened to me. When I came to see you, I was so terribly sick, but it was viral. And you said, you know, I'm not going to give you a prescription for an antibiotic because it's viral, but if it becomes an infection, let me know. And like the next day, it was exactly that. My sinuses got infected, and we went that route. So that's interesting that you say that. And I've mentioned that to a lot of people since that happened. You know, we've talked about it. And, you know, on that note, talking about the fact that I was so sick the beginning of January, really, because it was over New Year's Eve. And, you know, there's so many people that are talking about, well, has this been around for a long time? You know, long time, relative. But Corey had some really good questions that relate to that. You know, people who may have had it before and don't know it, or even people who have had it now that have been diagnosed. And if it's okay, I'd like to bring Corey back in. If Corey will come back in, there she is. And
Hello.
let her ask you, because she had some great questions that we talked about right before you came aboard. So Corey, you have the floor.
Hey, Dr. John, how are you?
I'm doing well, Corey. Thank you for asking. And you?
I'm doing fine, thank you. Nice to meet you. Now I have a cough. Of course, now it's just contagious.
It's kind of like having an itch when you see someone with a rash, right?
Yes, yeah. Absolutely. So one of the questions I had is if you've had the flu. I had a customer who actually tested positive for the flu, was very sick for 7 days, and then went back to work. So are they more susceptible to this COVID-19 because their immune system has already been weakened because of the flu?
That's a great question, Corey. So what we're learning now is that a patient could have influenza, or one of the strands of influenza, and there's multiple strands that fall under the influenza A and influenza B category. We're finding that even though they're positive for influenza, they could have actually also had the COVID-19 virus simultaneously. But if we think about how our body responds to illness, so for me, I get the flu, I don't take Tamiflu. Some people like it, some people don't. Not my jam, right? I want to make sure that I'm taking the right nutrients to boost my immunity system. I want to make sure I'm getting the right amount of sleep, and so to boost my immunity that way, because my body's producing a lot of white blood cells to attack that virus and to help me fight that virus so it doesn't proliferate throughout my body. And then when it's in my lungs, if it settles there and dies, then you have this viral pneumonia that then becomes a bacterial pneumonia. So surely you're become immunosuppressed if you're really battling that. In some cases, and I'm around sick people all the time, I have my own private practice, so I have about 200 patients. I also work with MedFast Urgent Care Centers, so I'm kind of in their offices all the time. Sometimes I pull a shift. And then, you know, my background's emergency medicine. And I don't have a spleen, so that's something very personal about me. So when your spleen helps you build your immunity system, it's part of the lymphatic system to help fight disease. And so I'm highly susceptible. But interesting enough, I actually watch my diet. I make sure I exercise. I have a good sleep, meditation, and spiritual regimen. So I kind of look at that whole health piece to keep myself strong so I'm not suppressed. But yes, if you're fighting something actively and you're kind of on the tail end of that, could you increase your risk? Sure. Does it make you more susceptible? Sure. Does it mean you're going to get it? Not necessarily.
So then my next question is, if somebody previously had the COVID-19 and perhaps didn't know about it because the tests are just now available and they appear to be better, are they contagious?
I think the real answer to that is we don't really know. Okay. That being said, when we look at viruses in general, We know a lot about coronaviruses. Most people don't understand that the coronavirus was first identified in the 1960s. And there's 7 different coronaviruses. 4 are very common. They make up 10 to 30% of our respiratory viruses or respiratory illnesses that we get in our country. The challenge is the new ones, the novel coronaviruses, so to speak. That's SARS-CoV, the MERS-CoV, and the SARS-CoV-2, which we know is COVID-19 viruses. We don't know nearly as much about the COVID-19 one. So traditionally, when patients have fever, we wait for them to not have fever for a specific period of time. And then once they haven't had fever without medication, then we would say, okay, it's okay or safe to return back to work. In some cases, like with COVID-19, they want no fever. And this is coming from the CDC and from the World Health Organization based off what they're finding in China and Italy and Iran, particularly those countries, where they're saying fever-free without antipyretics. Antipyretics are medications that are fever reduces, and then a reduction in symptoms, and that means reduction in shortness of breath, a reduction in the cough. And what's interesting is around day 10, patients are not they're losing the sense of smell and the sense of taste. So and I've actually personally had friends who have been exposed and contracted COVID-19, and they're explaining, there's like, you know, John, I thought I was kind of towards the end of this, and all of a sudden I couldn't taste my food. And so, but they didn't have a fever. And so I think we're still watching it. And so this current guidelines have instructed us to do, originally it was 2 nasal swabs, wait 24 hours, and do 2 oral pharyngeal swabs. Now it's just 1 nasal swab, wait 24 hours, and then do another nasal swab. And this is for people who have confirmed lab cases of the COVID-19 virus. So if you don't know and we're not sure, it's a little trickier, because I think what really the uncertainty that we're experiencing in our country is the fear of the unknown. We don't know how infectious this is. We just know it's infectious, and we know it's new, and that's scary. Yeah. For some families, it's about mortality and death, and in other families, like, you know, we're relatively healthy and it's not affecting us, so what? But reality is it's infectious, and we don't know how infectious. It's just happening very, very quick.
So with that leads perfect to my next question. So I go out and I have my N95 mask, and I have gloves and my sanitizing spray. So when I go to the stores, I put on my gloves, and as of yesterday, when I go in, I do wear my mask and I keep my distance. You know, I see people touching food and putting it down, and touching food and putting it down, and I'm like, ah! So my other question is, I've also watched the video where the doctor brought home stuff, and, you know, he has one side that's disinfectant, and then he brings in the bags and he's wiping everything down and taking stuff out of boxes. And people have said, take your shoes off and take your clothes off before you come in the house. And so can you kind of give us a guideline? You know, is that all necessary at this point?
That's a great question, and I'm smiling really big because as a nurse practitioner, I'm classically trained as a nurse, and I'm gonna call Amy out. I know Amy because Amy's a registered nurse too, with emergency medicine and case management and intensive care background, and many of us in the profession would go work in the hospital and come home, strip down in the garage, and come into the house because cooties are real. You know, it just didn't happen when you were, you know, 8 to 10 years old in elementary school. And so when you think about the COVID-19 virus, there's some literature that varies. It's very inconsistent. But what we know is that the virus lives on surfaces. And depending on the type of surface, depends on how long. And I've seen some data that reveals up to 3 days on things like metal and plastic, and I've seen data up to 9 days.
Ooh.
Okay. Now, 9 days seems to be a little excessive, but the reality is when we have a novel coronavirus, so a new uncommon coronavirus, we're still learning many things about this virus as it mutates and proliferates in the different countries. So we know that it can live on surfaces. So cleaning the surface with soap and water. I'm not washing my fruits and vegetables with alcohol unless I'm making my own wine. I don't drink, so but we could do that. Just make it more like moonshine, because that has a higher alcohol content, not like vodka, which doesn't have a high enough alcohol content. But I would surely wash my fruits and vegetables with soap and water and rinse them. When it comes to food, wiping the outside of containers is good practice, because you don't know. So like you said, you wear your mask, you wear your gloves, and gloves are protecting you on the inside, but it's not protecting other people, from what you touch, right? So if you do one of these, right, inadvertently, because it's habit, then, and you're in the grocery store and you're like, oh crap, I don't have any hand sanitizer, and there's definitely none to buy. So,
Yeah.
you just use the last of it, and then you're shopping and you're just trying to be careful. And I think people are trying to be careful, but even though they're being careful, doesn't mean that there's still not risk there. So let's take away, I want to add that surfaces have a life expectancy for the coronavirus, but why the N95 mask versus a surgical mask or a face mask, right? And the reason is the same. Yes, ma'am.
Explain what a N95 mask is.
I'm going to right now.
Okay, I'm sorry. I don't even know what any of those things are. Just a mask is a mask is a mask.
Sure, and Corey goes, yeah, I wear my N95 and stuff like that. So
I sell industrial maintenance products, so I happen to have as a sample my N95 mask.
Yeah, so it's good.
I am so uninformed on these things, Corey. You're blowing me out of the water here. I'm like, what's an N95 mask?
It's ones that they can't get.
So N95 mask, and if we look right here. Okay, that is a filter. Okay, N95 mask is actually a respirator, and it's been tested to filter out organisms like viruses or as particles as small as a virus. Whereas when you look at traditional surgical face masks that you might see on television, or a face mask that you may get at a at the health store or at Home Depot, just your typical like paper, that does not filter out particles as small as viruses, but they do filter out some. So it's kind of like something's better than nothing in that case. And you wear them for two different reasons. One is if you're sick, you want to wear one so that whenever you cough or sneeze, you're not projecting virus or bacteria out. Okay, it's kind of catching it right there. At the same time, by you wearing it, if someone happens to sneeze or cough at you, not hurt you, but at you, it provides a barrier. Is it a perfect barrier? Absolutely not. So when we look at the N95 actually has a nose piece, and it kind of goes here. And when you're in the medical community, we will spray some sugar spray or some kind of, if you're in aromatherapy, using some kind of aroma around to see if you have a good seal. We do that to make sure that you can't smell it. And if you can't smell it, means that you have a good seal. And then the filter at the front will actually are filtering out, particles and stuff like that. So that's kind of the difference between the two. The challenge is that we have a shortage nationwide, in some areas globally, and we're having to reuse them. And this is really, really difficult for our healthcare professionals. It's one reason why in my practice, there's a lot of practices shut down. In my private practice, I haven't shut down. I do telemedicine visits. I still do face-to-face visits, but I gown up to protect them because I'm in contact with a lot of people. And we're just trying to keep people out of the hospitals, keeping them out of the emergency department so that we don't endanger our medical staff and so that we don't endanger our patients, right? Because there's stuff there. So the N95, getting back to that, it actually protects from aerosols. And while viruses are typically transmitted through droplets, which is why it gets on a surface and you have to clean that surface. When you sneeze or cough, if you have confirmed COVID-19, that virus can go in the air and circulate for about 3 hours.
Yikes.
It's 3 hours. So the smaller the room or the more contained it is, the higher the risk are.
That's scary.
Sure. So be careful who you go out with.
Yeah.
You're not supposed to go out with anybody.
Oh,
Okay,
that's
well,
right.
Let me ask you a question on that note. Let me ask you a question that's pretty relative to our community here. The beach and the pool.
Yes.
So, beachside, it's interesting to watch the flow of people out at the beach. There are more locals at the beach than ever before. Most of the tourists are gone, but it's interesting to see the behaviors. And I can tell they're locals because they're out in the water and they're boogie boarding and surfing and that sort of thing. It's local behavior. Lots of people at the beach. Lots is relative. And people at the pool. So from your standpoint, just kind of curious, and I will not say whether I am partaking of either of those behaviors or activities. I plead the fifth. But so what's your take on that? What do you think about the risk involved? And I know this is a very controversial subject in the area at the moment.
Can I answer that before he does?
Yeah, you can.
Stay home.
But on the other hand, now see, we were talking earlier about the benefits of, fresh air and the sun and, that sort of thing. So it's like, how do you,
a porch or a backyard?
so some have a suntan that looks like this.
Well, you don't have to wear it outside in your own yard, right?
Yeah.
So,
but if it's in the air for 3 hours.
Again, what was the key word that I said there, which is if you're contained in a small area.
Okay.
So if you have someone in your household, you can't ask them to move away and stay at a hotel while they're sick.
Well, you could, but it wouldn't be nice.
Well, you can't because hotels are shut down and they're not taking any reservations.
True that.
Right? So they
get to the she shed.
Yeah, you're in the doghouse, you're sleeping on the couch, or whatever the case may be is actually going to happen, right? You need to separate yourselves. So let's go back to the original question regarding the beach and the pool. I had an interesting conversation with one of the emergency management providers yesterday. He's the chief for one of the fire departments in our community. And MedFast Urgent Care works very directly with those guys, and I've been helping Dr. Dave Williams from MedFast on keeping track of the staff and the first responders who are coming in contact with people with COVID-19. We were talking yesterday about a positive result, and he goes, John, what really gets me is there's hundreds of people on the beach. Hundreds. And it's like, what needs to happen for them to realize that this is an infectious virus and it has no age, has no race, has no religion. It can affect anybody. I can tell you that 3 of my positive cases that I'm aware of, direct from testing, are all under the age of 30.
Oh, that's interesting.
Now, what's that mean? Because when we look at the current guidelines for testing, and Amy and I had a discussion about this over the weekend or last week, the guidelines are saying, you know, if you're over 65, stay at home. If you have comorbidities such as diabetes, heart disease, chronic obstructive pulmonary disease, kidney disease, you're on immunosuppressive therapy and those kind of things, to stay home. And then everyone else is kind of like social distancing, be 6 feet away. From a healthcare perspective, they're saying, look, as long as you're greater than 3 feet away, you don't have to have that mask on. And then if, you know, so like if we look at the intake people at MedFast that are signing people in, if someone comes in, there's a, or even at the Rockledge Regional Medical Center, the emergency room, they have a face shield and they're 3 feet back from people, that at that point in time you wear a mask. If you're 6 feet, which is 2 meters, if you're greater than that, then it's okay. But reality is if this virus resides on surfaces, if this virus can and indeed sit in the air for up to 3 hours, I don't think you really need to be out unless it's, you know, absolutely necessary. You know, I think the only ones who need to be out, and the risk even increase here is you know, people like Amy and I, who working 15, 18, 20 hours a day out in the community, we're not getting time to go to the grocery store. Okay. And I'm not sending my family to the grocery store. I'm like, you know what? I'm out in the community. I know my precautions, and Janice knows, because when I went out to Janice's car to see her the other day to do some parking lot medicine, you know, I had an isolation gown on, I had my gloves on, I had my mask on, and I know how to remove them. So I know how to put them on, I know how to take them off. And so I'm using those precautions, but at the same time, you know, boy has to eat.
Yeah. Yeah.
So with that,
Go
I have
ahead.
another question. With that being said, so when I come out and I take my gloves off, I know how to properly take them off and fold themselves into each other, and then I throw them away. But are you able to, like your gown, we did see a picture of you, by the way, all decked out in your in your precautionary stuff, which was good. And I appreciate you and Amy, by the way, for your hard efforts in all of this. But are you able to like put that, are you throwing that gown away, or can you put it to the side and let it die out like a week later or something? Can you reuse them down the line?
So remember this, a virus needs a host to live. Okay, and then it still has a life expectancy, and it's not a living organism, but to be able to mutate, it needs a host. And so at some point in time, it dies off. So the influenza virus is a very common one. We know the length of illness is 5 to 7 days. You're going to catch it. You're going to be sick for 5 to 7 days, whether you take antivirals or not, which is one reason, unless you have a specific reason to take the antiviral, in other words, high risk, I'm not a big prescriber of it, right? So we know it's going to last this long. The coronavirus, we have a timeline on how long it can last up to, right? I've had patients already who have been asymptomatic after 5 days, and these are people who tested positive, and these were young people. There's been reports that revealed people from 10 to 14 up to 25 days having some symptoms.
Wow.
Okay. And so there's not a lot of consistency yet in the data that's available from that perspective. So with the gowns, when you're working in a medical care facility, we have a shortage. We have to reuse them. Dr. Williams and myself have been very creative and innovative in getting equipment for our staff. So we have, at least right now, what we've needed. And so I actually changed the isolation gowns that cannot be cleaned after every patient. That's the beauty of having my own private practice and doing it membership based. I get to do what's best for my patients no matter what. And I've already bought the stuff and I'm not looking to get reimbursed for it, so it's not an issue. So how we dispose of that, whether you're disposing of a tissue from blowing your nose, or a napkin that you've coughed into, or anything that's been contaminated, it should go into a lined trash bag. Not a paper bag, but a lined trash bag, plastic bag, and then tied up and be disposed of that way.
Thank you.
Welcome. Thank you, Corey, for all your questions and being so attentive.
She is a great question asker. I'm so glad that she was
Probably called her today. I want you to come in and dog Dr. John.
No, no, I was so happy that she was going to join us because I knew she'd have good questions. Corey is has a very interesting background herself, and she sells essential oils and is very, very well versed in all of those things. We're almost out of time.
You are. I see that 39. So we'll talk a little bit about Corey and the essential oils, and I love it because you know, for those people who really aren't looking at the traditional medicine side of the house and you're looking at essential oils and stuff like that, there are a number of essential oils that are out there that actually can help boost the immunity system. Things like eucalyptus, frankincense, amongst a number of many others. So if you kind of go back to the Spanish flu in 1918, homeopathic medicine actually had a greater success rate in treating patients who had the Spanish flu compared to the traditional medicine providers. And people say, why ask this? Just remember, when you're talking viruses, the virus is going to take its course. When the virus takes its course, you still have to treat the symptoms. And so we're not looking at a root cause analysis like when we look at traditional medicine, or well, actually, I would argue that traditional medicine doesn't always take a root cause approach, but a functional medicine approach actually does. And when you look at some of the integrative therapies that are out there, you're actually really looking at those symptoms to kind of help boost the body's natural response to make them better.
Amen. Well, I want to say first, before I start wrapping us up, in the chat, if you didn't get a chance to see, there were a couple of chat comments. Amy let us know that she's eating a bowl of berries that were rinsed quite well. Good job, Amy. And Justin shared an interesting video about the potential impact on the spread of the virus from individuals visiting the beach. So when we finish up, I'm going to go take a look at that myself because that's interesting. But I want to wrap up by saying this. I knew that we absolutely would not get to talk about all the things that I want to talk about because I want to talk about everything. And I know Dr. John doesn't have time for all that. But I do want to say that one of the things that I love so much about your practice is how out of the box you are. And the whole reason that we did this is because in my business, I'm really looking at people who are doing things outside of the box right now. And you do things outside of the box all the time, and you have been for a long time now, or as long as I've known you, which is not really that long, but it makes me happy. I've been looking for you for about 10 years, and I'm so happy to find you. So please take care of yourself.
Don't make me cry. I'm a nurse. Remember that.
Right? Don't make me cry. I'm just a crybaby. So, but let me ask you this. So what you did for me this week was wonderful because, I have some immune issues and I was a little bit concerned. The pollen is out of this world right now. I have this stupid cough. I've been trying to hold it back the entire time we've been doing this. And so when you saw me, you really gave me some peace of mind and some tangible things that I could do to feel better. But So the big question is, you know, I talk about you all the time. I promote you all the time. I think you're a wonderful, wonderful solution for healthcare. And are you taking patients? That's my question.
I am.
Okay.
So, you know, I use a model that's kind of referred as the direct primary care model and kind of manipulated it to my way of thinking. We traditionally have anywhere between 400 to 600 patients compared to 2,500 to 4,000. I see one patient an hour, unless it's a telemedicine visit. That way you always have enough time for that one last question. And we actually get to know each other, make each other vulnerable to one another, and so that I can provide the best care for you from a what I call my 5 pillars of wellness perspective: spiritual, mental, emotional, physical, and financial wellness, right? And so yes, I'm taking patients now, and you need some raw honey and some hot water and lemon for that cough.
I do. And it's been bothering me so bad. I was like, I can't sign off. I'm the host.
My website is Island Direct Primary Care, and I'll type it in the chat, but that's islanddirectprimarycare.com. And then if you click in the upper right-hand side, that's where you would enroll. And it's a membership based off of age. And I do see children. My youngest patient this year was 5 days old. She's going to turn 1 year old in a week and a half. And so I probably have about 20 kids that are getting wellness checkups and stuff like that. I have 200 patients, and so I got plenty of room for growth.
Well, that's very good.
Do you have access to the test for the coronavirus?
So there's still a shortage of tests, so I'm not testing carelessly.
Okay.
That being said, in partnership with MedFast, we're making sure that those who need to get tested right now.
Right.
And it doesn't always happen that way. And what happens is sometimes someone who will know me personally will give me a call, we'll talk, and we'll make sure that that person gets tested. They're loosening up the criteria, so it's really based off of supplies. I will tell you that I have on order 200 tests that will test antibodies versus testing the active virus, which will let us know if you've been exposed in the past. So it will check immunoglobulin G and immunoglobulin M. And so we're waiting anxiously for those. I can tell you that, look, everybody is being hit hard financially because of this. And the people who are selling this are not doing us any favors. So I know for me, cost transparency is a big thing. My patients know exactly how much I make, how much I charge. I tell them everything. The first set of tests I bought were for $9.95. I received an email from one of my distributors saying that they had a similar test. It was $33. Okay. And so, and masks are $5.50 per mask. And yeah, so it's going to be really interesting to see how that plays. I have a lot of resources though. Dr. Williams and I have traveled internationally. We both military guys. We have a lot of contacts, so we are reaching out to them and using those resources to provide the best care we can for the members in our community. And I know I keep mentioning MedFast, one, because I work there. And that's where I rent an exam room. I rent an office there, so I pay rent. That's where I see my patients in Merritt Island. But at the same time, it's where there's 3 sites set up for testing right now. So if you have a fever, if you have a cough, if you've been exposed to a lab confirmed COVID-19 test, absolutely you're testable. If you're over the 65 and you have those symptoms, even if you haven't been exposed or confirmed, we are now testing for COVID-19. So you just call one of the MedFast telephone, one of the companies, the offices, the clinics, and they'll direct you to where the test centers are.
Thank you for fighting the good fight, Doc.
You're welcome.
Absolutely. I want to thank everyone that was here today. Dr. John, I especially want to thank you. I also want to apologize because I sent you that long list of information for you to fact check for me, and you did all that work and we only talked about, I think, one thing there. So what I might do is maybe when you have a moment, we'll chat about it, and I might send that out so all your work wasn't for nothing. And maybe we can do this again if you have time. And there's so many questions and so many things we can talk about, and so many people who are really looking for that knowledge and looking for someone who can educate us, because we're all internet smart and internet dumb. So.
Well, thank you, Janice, and thank everyone for taking time out of your day to. I'm humbled that you guys took the time to really talk about what's happening in our community. I see my job as a servant leader for those around me, and so that's why I'm here. So if there's anything that the community needs, I want to be there. I mean, it's just what I do. It's my passion. It's what I love to do. And so I'm happy to do it again, and we'll make it happen.
Yay. Thank you so much. Everybody have a good rest of your day. Stay off the beach. Just as a disclaimer in closing, I've only been to the pool once and not to the beach at all.
Florence Nightingale.
Yes.
Okay. Back in the Crimean War over in Europe, the best thing that she did for our soldiers was give them sunlight.
Yes.
Okay, so sit on your porch, sit in your backyard, and get sun, get some vitamin D, and make sure you eat foods that have zinc and selenium and omega-3s and vitamin C's, maybe even increase your vitamin C to 3,000 milligrams a day, right, to boost that immune system, okay?
And Amy says, wear your sunscreen.
Oh, yeah, well, Amy's pale.
Okay.
I love you, girl.
Thanks again
Thanks
for coming. We'll see you next time.
All right. Bye, guys.